We got a full house here, folks, so we'll get right at it. Good afternoon. I'm joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli. To her right, another familiar face, the state's epidemiologist, Dr. Christina Tan. Great to have you both. The guy to my left who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. As the Department of Health noted yesterday, we are continuing our work to receive all the information we need from the White House, the Republican National Committee, and the management of Trump National in Bedminster with regard to our contact tracing efforts following last week's fundraising event with President Trump. We have received the list of the 206 attendees at the two separate events held in Bedminster, and from the golf club we have received a list of 19 staff members who were involved in these events. New Jersey residents are our top focus, but we are also working with the CDC to contact all out-of-state attendees. All attendees have been notified that they may have been potentially, bless you, exposed to the, we're going to have to ask you to leave, Brent, to the coronavirus, and informed that they should self-monitor for potential symptoms. We are asking that all attendees self-quarantine for 14 days, especially those who were in close contact with either the President or a member of his staff. We have also urged attendees to get tested no earlier than 5 to 7 days after the event, which would mean a testing window from tomorrow through Thursday at the earliest. We know it can take up to a week or even longer, and Judy and Tina can pile in here and add to this in their remarks, for the virus both to incubate and for an infected person to test positive. So even a negative test taken within this window should not override the need to self-quarantine for a full 14 days. Based on the information that the DOH shared with attendees, the CDC feels we have completed the initial outreach and will stand by to assist further if needed. I hate acronyms, I just used two of them. So the Department of Health and the CDC in Washington. The Department of Health, under Judy's leadership in partnership with the Somerset County Health Department and local officials in Bedminster, is leading the contact tracing efforts within New Jersey. This includes notifying the staff at the golf club, and we have particular concern for them considering the potential for spread within our communities since this is where they live. This is very much a race against the clock. As with everything, the Department of Health treats this data and information with the utmost protection and does not share the list beyond those who need this information for follow-up. We certainly hope and pray fervently that no confirmed cases come out of the event in Bedminster, and we continue to send our best wishes and prayers to the President, the First Lady, former Governor Chris Christie, and all who have tested positive over the weekend. This is not a matter of politics, but a matter of humanity. But this is also a matter of leadership by example, and it is clear that the President and his staff acted recklessly in coming to New Jersey in the first place, knowing that they had been exposed to someone with a confirmed positive test. As I mentioned in some interviews this morning, this is also not while it is hitting close to home, this is not the first time we've seen that absence of leadership, or the only time. This is the latest chapter in a long series of chapters over the past 7 months with things like developing and engendering a political debate over masks as an example when there should be none associated with it. This is based on science, data, and the facts. It has nothing to do with politics, and yet that has been allowed to take hold. Additionally, reports suggest the event itself may not have complied with our current rules, which may have put others at risk, and we continue to investigate these reports. Any failures to comply with our emergency orders will be referred to Attorney General Gurbir Grewal for follow-up. To put it bluntly, the actions leading up to and during this event have put lives at risk. Next, switching gears but sticking with the Department of Health, the department is today releasing, again under Judy's leadership, its guidance for local officials, schools, and outside organizations and businesses to help ensure a safe Halloween for our communities. Yes, Halloween is on. First and foremost, the department is encouraging everyone to wear a mask that covers both the nose and mouth. And no, Pat, that Jabba the Hutt mask that you were considering is not a substitute. A costume mask does not count, as it does not provide the necessary level of protection. The department's guidance also strongly encourages that instead of placing treats directly in the bags of trick-or-treaters or filling communal bowls that multiple hands will reach into, the treats be arranged in such a way that they can be quickly and safely accessed without multiple pieces being touched. We are also strongly encouraging all Halloween activities to be outdoors, as we know that the biggest threats for viral spread exist indoors. And as always, parties are subject to both indoor and outdoor gathering limits. You may wish to dress as a knucklehead this Halloween, but we don't want anyone to act like one. For Halloween activities such as hay rides and corn mazes, the department is also providing guidance for their safe operation as well. We know that in numerous communities, Halloween is more than just a fun activity, but a real tradition. We want to ensure that everyone has the chance to enjoy Halloween, but we also want to ensure that everyone does that safely and responsibly. Next, switching gears, in response to schools going all or partially remote, we have received numerous reports of dance studios, martial arts studios, churches, and other locations providing remote learning supervision services for children during the school day when their parents are at work. Under state law and regulation, these setups are in fact child care centers that need to be licensed. However, the Department of Children and Families recognizes the growing need for these services. It has created emergency regulations to allow these centers to undergo an expedited licensure process so they can operate legally for the duration of the public health emergency or until the end of the school year, whichever comes first. The department stands ready to assist these facilities in moving through this process. We want to ensure that every family who needs child care services during remote learning times has those services within reach, and we also want to ensure that these facilities are properly prepared to meet the needs of both students and families. I thank especially Commissioner Christine Norbert-Beyer and her team for taking these steps. And also, on the topic of child care, the Department of Human Services has increased the income threshold for families seeking child care tuition assistance during remote learning school hours from $75,000 all the way up to $150,000. This will allow more families to receive the support they need to afford child care. The application for this assistance can be found at childcarenj.gov and then /COVID-19, childcarenj.gov/COVID-19. And I similarly thank Commissioner Carol Johnson and the team at the Department of Human Services for their efforts to expand this vital assistance. Next, an announcement that is not related to COVID-19, but one that is related to an issue that has been discussed over several years, and that is the bear hunt. As I have noted in the past, this is a complex issue, and one that my team and Commissioner Catherine McCabe and the Department of Environmental Protection have been looking at carefully in partnership with the New Jersey Fish and Game Council, which actually has the authority over the hunt. Today, the Council has proposed an amendment to the Game Code that will suspend the bear hunt following the conclusion of the 2020 season and would remove the current comprehensive black bear management policy from the Game Code. This would allow the Council and the Department of Environmental Protection to engage in a thorough and complete review of current scientific data in developing a new black bear policy that promotes public safety and welfare while protecting important wildlife with a focus on non-lethal management techniques. This means, drumroll, that the 2020 bear hunt, already limited, by the way, to a few days in October and December and pursuant to my 2018 executive order not permitted on state lands, will be the last bear hunt under my administration. I am grateful to the Fish and Game Council for their commitment to working with the DEP to address this issue and to chart a better way forward. And finally, one more gear shift before we get to the numbers. A quick reminder that the new voter registration deadline is Tuesday, October 13th. That's 1 week from tomorrow. We encourage those who still need to register to vote to use our secure online form accessible at elections.nj.gov, that's elections.nj.gov, and clicking the link for the 2020 NJ Voter Information Portal at the top of the page. Again, that's the 2020 NJ Voter Information Portal at the top of the page. Mahin, we don't have it today, but on Thursday, let's tell folks how many folks have already registered online since we started allowing that. With that, Judy, let's look at the overnight numbers. We're reporting an additional 522 positive test results, giving us a statewide cumulative total of 208,713 since our first positive case was confirmed on March 4th. While this virus clearly remains a threat statewide, we continue to keep our eye on key counties and localities where there are current outbreaks and elevated numbers. We remain concerned with Ocean and Monmouth counties in particular, which account for 167 of the newly reported cases today. That's roughly 1/3 of all new reported cases. Ocean County reported 119 additional, of which, by the way, 86 are from the community in Lakewood. Monmouth County reports an additional 48 cases. The statewide positivity for all tests recorded on October 1st was 2.62%. That was last Thursday, by the way. The statewide rate of transmission is currently a little different format today. I'm not sure why, but if you can't read that, it's 1.27, which is higher than we would like. And again, I encourage everyone to download the new COVID Alert NJ Exposure Notification app, which is available for download through both the Apple App Store and the Google Play Store. The more phones that have the app, the better we can fight this pandemic everywhere across our state. In our hospitals, as of last night's report, there were 320 known COVID patients, 187 patients listed as persons under investigation pending the return of their test results. That's a number of 507. And Judy, that is the third day in the past 5 that we've been over 500. So that's something obviously we're watching very closely. Of those, 102 were in intensive care, 34 were on a ventilator. And today, with a heavy heart, we're reporting 2 additional fatalities, bringing the total of confirmed deaths to 14,351. These deaths, both of them, occurred on September 26th and 27th, respectively. The number of probable deaths remains at 1,787. Again, at the risk of comparing apples to oranges, there were 9 deaths reported in our hospitals yesterday. However, as these are not lab confirmed, they are not included in that count. As we do every day, let's take a couple of minutes to remember 3 more of the residents who have passed away because of complications of COVID-19. Today, we remember a couple. They are Dr. Barry and Sharon Sakowitz. They were both New Yorkers by birth and New Jerseyans by choice. They lived for many years in Woodcliff Lake before moving to Hillsdale, where they would spend their final years together. They died 4 years apart. In fact, Barry passed on the day of Sharon's funeral. You can't make that up. Sharon, Judy, was a career nurse, holding nursing degrees from Adelphi University, not far from her native Queens, as well as from the University of California, San Francisco Medical Center. And later she would be a nursing director at the Eastwood College Hohokus School, where she taught anatomy and physiology and played a key role in curriculum development, including the launch of the school's sonogram program. Away from the hospital and the classroom, Sharon was a leader in her congregation at Temple Emmanuel of the Pascack Valley, and when her children were in school, she also helped lead the Woodcliff Lake PTA. She was a member of book clubs and needlepoint groups and never turned down a game of mahjong. Dr. Barry, her husband, specialized in internal and pulmonary medicine and practiced alongside his brother, Dr. Arthur Sakowitz, right up until COVID-19 prevented him from seeing his patients. The brothers helped to establish the respiratory therapy department at the Valley Hospital in Ridgewood, with which they enjoyed a more than 3 decades-long affiliation. Before Barry received his MD, he had earned bachelor's and master's degree in electrical engineering. He took enjoyment in fishing, playing bridge and chess, cheering for the New York Giants, and taking his grandchildren to the Rockland Bakery for a few special treats. Barry and Sharon both cherished every moment spent with family, especially their family trips to Maine and time with their friends. They leave behind their children, Jo Ellen Sakowitz Klein, Dr. Noreen Sakowitz-Cohen. I had the honor of speaking Noreen, who, by the way, is also married to an emergency room doctor, and Randy Sakowitz and their spouses, along with their 4 grandchildren, Jason, Dylan, Sammy, and Haley. Barry was 75 years old. Sharon was 74. May both of their memories be blessings. Next, we celebrate the life of James Hendler, second from the left. He was 72 years old. He went by Jim, though a chosen few could call him Pat Jimbo. Jim was a native of Pennsylvania, and life brought him to New Jersey, and he lived in Matawan and Middletown, where we live, before settling in the Wayside section of Ocean Township 40 years ago. Jim was an engineer by education and training, holding degrees from both Notre Dame and Columbia, and he worked at both Lucent Technologies and Fort Monmouth. Since his move to Ocean Township, Jim had been an active parishioner of the Church of St. Anselm. He took tremendous joy in family visits, vacations, and celebrations, and equally enjoyed getting together with close friends for dinners, card games, rounds of golf, and pizza parties on the beach. And it should go without saying, he never passed up a chance to watch the Fighting Irish of Notre Dame play football. Jim leaves behind his wife of 47 years, right there in the middle, Nina, with whom I had the great honor of speaking on Friday, and their children, son Joseph, who's also a Notre Dame grad, and daughters Catherine and Allison, and they are respectively in New Jersey and Brooklyn, and their families, including his beloved grandchildren, Hudson, Emma, Braden, Addison, Ivy, and Hazel. He is also survived by his brother Charles, several sisters-in-law, and 15 nieces and nephews. May God bless and watch over Jim and his family. So the Sakowitz and the Hemler families are just two among the many thousands who know all too well the ultimate cost of this pandemic. Yes, we are thankful that the numbers of those we are losing to this virus are much lower than before, but we cannot consider our jobs done until that number hits 0 and stays there.
94 new cases reported over the weekend. 353 were from Ocean County. The majority of the cases are in the 30 to 49-year-old age group, followed by the 18 to 29-year-old age group. Today, there are 119 cases from Ocean County. 86 of those cases were in Lakewood. As of September 30th, the positivity rate in Ocean County was 7.2%. The Lakewood positivity is down from 28% to 19.51%. We have increased testing sites in Lakewood. Today, testing is available at the Blue Claws Stadium from 9 to 4. Today and tomorrow, testing is available at the Lakewood Municipal Lot from 9 to 3. Tomorrow,
Good afternoon, everyone. I'm honored to be joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, the Department of Health's Communicable Disease Service Medical Director, Dr. Ed Lifshitz, another familiar face. Great to have you both. To my left, the father of the groom, otherwise known as Superintendent Colonel Pat Callahan, again, a name and person known to everybody. Jared Maples, Director of Homeland Security and Preparedness, is with us. Good afternoon. So our flags fly today at half staff in memory of the late Supreme Court Associate Justice Ruth Bader Ginsburg, who passed away on Friday evening. They will remain, by the way, at half-staff until her burial later this week at Arlington National Cemetery. As a member of the Supreme Court for the past 27 years, Justice Ginsburg set herself apart as one of our nation's most influential jurists, not just of our era, but of any era, one whose dissents were often considered as historic and meaningful as the majority and concurring opinions she wrote. She was a forceful and thoughtful judge and was an icon in the legal field long before she became an icon in popular culture. And for us in New Jersey, we remember the special role our state played in her life. From 1963 to 1972, Justice Ginsburg was a sought-after professor at the Rutgers Newark School of Law, as well as an advisor to the Women's Rights Law Review. Following her tenure at Rutgers, she was the first director of the Women's Rights Project of the ACLU, which has led many fights for gender equality and equity. And those fights educated many of Justice Ginsburg's own opinions. Last year, I had an incredible and distinct honor of presenting Justice Ginsburg with the Golden Pea Award from the German organization Märchenland Berlin. It was a small ceremony held at the Supreme Court. The First Lady accompanied me that day along with our daughter Emma. There on the right, and second from the left, by the way, is the German ambassador to the United States of America, Dr. Emily Haber. Justice Ginsburg was extraordinarily generous with her time. She gave us a literally 30-plus minute portrait-by-portrait tour of the chambers. After the ceremony had taken place, which she had every right to have gone back to her office, she insisted on staying, and she was extraordinary. She went through each of the portraits of Supreme Court justices, explained who they were, their history, their tendencies. It was an extraordinary history lesson, was an extraordinary moment. I can tell you, we will never forget that day. She was small in stature, as you could see from the photo, but she was a giant in her field and in our nation's history. No doubt her reasoned and sharp opinions will be quoted and re-quoted for generations to come, and may her memory be a blessing. And with that, may the posturing that has already commenced be a cautionary tale of how our national politics has careened off the rails over the past 4 years. The rank hypocrisy of those like Senate Majority Leader Mitch McConnell is showing. They want to ram a nominee through 6 weeks before a presidential election, when just 4 years ago they refused to offer even a hearing to a nominee whose name was put forward 8 months before an election. Let the people decide, they screamed in 2016, but today they're thumbing their noses at the people in the name of a narrow political ideology. How many Senate Republicans will have the guts to stand up and demand that the process be put on hold until after the nation chooses its next president? That's really a rhetorical question, as so few have shown any guts over the past 4 years. Please, God, can 4 of these people channel the likes of John McCain and others who went before them. But for them, this isn't about the nation's future. It's about reasoned jurisprudence. It's a blatant power grab by those whose mission is to undo decades of civil rights progress, protect polluters over the environment, gut health care for millions of Americans, and deny a woman the right to make her own medical and reproductive decisions. And right now, our attention and the attention of the President and Congress should be focused on the pressing issue of getting ahead of COVID-19 and ensuring a comprehensive national response and recovery. We cannot be distracted from that goal. I think I know what Justice Ginsburg's opinion would be on the matter, and there would be no lack of Americans who would concur in that opinion. And it's only rightful, I might add, that tomorrow is National Voter Registration Vote. So whichever side of this you're on, get registered and get out and vote. Next, switching gears completely, I'd like to highlight 2 announcements from the Department of Human Services, and especially and specifically from our outstanding Commissioner, Carol Johnson. First, the department is providing the opioid overdose reverse drug naloxone, commonly called Narcan, free of charge to residents with no need for a name, appointment, or prescription for 3 days, this Thursday through Saturday, September 24th through 26th. To receive free Narcan, you can visit any of more than 300 pharmacies statewide, including participating locations of Acme, CVS, Rite Aid, Save-On, ShopRite, Stop and Shop, Walgreens, Walmart, and Weis Markets, along with numerous independent pharmacies. For a complete list of locations, look at that website at the bottom, nj.gov/human services/stop overdoses. That's nj.gov/human services/stop overdoses. This is, by the way, our second annual naloxone giveaway, and last year we distributed more than 32,000, Judy, free doses to residents. We were so encouraged to see New Jerseyans from across the state participate and be a part of the fight to combat the opioid epidemic. I urge everyone to get your free Narcan this year so you too can help us save lives and get folks on the path to treatment and recovery. And even as we have been battling the COVID-19 pandemic, our efforts to curb our opioid epidemic have not stopped. And again, I thank Commissioner Johnson and all of our partners for their effort to make this second giveaway possible. In everything we do, it is about saving every life we can. Also today, the Department of Human Services, and by the way, Pat, you and your colleagues in law enforcement know what Narcan can do and how many lives have been reversed and brought back. And you and your colleagues live this every single day. Again, today, the Department of Human Services has opened up the window for families with children ages 5 through 13 to apply for our new COVID-19 Child Care Tuition Assistance Program. We know this is of particular importance to working parents whose children are currently learning remotely. Families with incomes up to $75,000 a year can apply online, and you can see it there, childcarenj.gov. Again, that's childcarenj.gov. And all you will need is a proof of income and a remote learning notice or announcement from your child's school. Tuition assistance will be available to eligible residents through December 30th. A total of $150 million has been set aside to support this program, and it is part of the broader $250 million plan we announced last month to ensure that more working families have access to the child care supports they need and to support our vital child care providers. And again, I want to thank Commissioner Carol Johnson, who's outstanding, and her equally outstanding team. With that, Judy, can we go to the overnights, if that's all right? We had an additional 396 positive test results, and we have broken through 200,000. It is now 200,154 since our first case on March 4th. For the tests recorded on September 17, the positivity was 1.81%. We'll stop here for 1 second. So 396 positive test results, big numbers over the weekend as well, Judy. Spot positivity has come down. It was over 2, in fact, almost 3 at certain points last week. Folks ask us all the time, hey, gosh, you're I think we've said this almost at every session we've been here for the past several months. Yes, we test per capita as much as virtually any state in America. We have, the team up here on either side of me and others behind the scenes went through hell and back to go from nothing, a pea shooter as a nation, never mind a state, to one of the most robust testing capacities in anywhere in the United States of America. So yes, some of this, when we print 400, 500, or in today's case 396 positives, some of that is due to the fact we've got big testing capacity. The good news is you're getting tested. There was a period, you probably may have forgotten this, but a few months ago, we were begging folks to go out and get tested. We had built the capacity, we had the supply, but the demand wasn't keeping up with that. But some of this is also community spread. Judy's been going through some of we had a long call today to go over a bunch of, we're challenged right now in Monmouth and Ocean counties, to be specific. We owe you the facts, folks, and that's why we go through this every day. And I think we've been very clear, when you're around 2%, and you've got around 4 100 cases, you can multiply that by 50 plus or minus to get some sense of the amount of people who got tested that day. And in this case, it's probably just about that, about 20,000 back from that day. So I wanted to get that off my chest. We're going to flip. The statewide rate of transmission sits at 1.12. It's been hovering, Judy, a little bit below and a little bit above 1.1. Based on those tests, particularly the 400 or 500 test days we got, I think you've been of the opinion for a while, it's going to be there for a bit. Our hospitals, as of last night, 185 confirmed COVID-19 patients, another 164 persons under investigation awaiting confirmation for a test. That's a total of 349, 87 of whom were intensive care, 32 ventilators were in use. We're reporting with a heavy heart 2 additional confirmed deaths, bringing our total of 14,278. Our number of probable deaths remains at 1,791. Again, apples to oranges, but for a spot look, our hospitals reported, Judy, my number has 6 in hospitals yesterday. Again, those are not part of these confirmed numbers, but just give you a sense of what it looks like on the front in the here and now. As we do every day, let's take a couple of minutes to remember 3 more of the members of our New Jersey family who have been lost to COVID-19. We'll begin in Bergen County, the lifelong home of Donald Landzettel. That is a German name. He was born and raised in Fairlawn. The Landzettels hail from Darmstadt, a city in Germany that I know personally quite well. Donald attended Fairlawn High and graduated then from Dartmouth College. He got married to his wife Gail on the right, and he joined the Army, retiring in 1969 at the rank of captain. In his private sector career, Don was vice president and retail manager for the Fairlawn-based and family-owned paint company Landzettel and Sons Laison Paints. But service was a calling. After Don and Gail settled in Allendale, he served as a leader of Boy Scout Troop 252 and was an active parishioner of the Archer United Methodist Church. He founded Allendale's annual community Christmas concert, and Don was also a member of AA and sponsored many others in their journeys. He was a member and former president of the foundation board for Newbridge Medical Center, which not only presented him with his Lifetime Achievement Award in recognition of his service, but also rededicated its interfaith chapel in his honor. Don leaves behind Gail, again on the right, and she and I had the great honor of speaking with her on Friday. After 59 years of marriage, he also leaves his daughter Susan in New Hampshire, and Lori in Jackson, and his sons-in-law Paul and Patrick respectively, and his 4 beloved grandchildren, Corinne, Brandon, Tyler, and Kirsten. We thank Don for his lifetime of service to our nation and to his community. God bless and watch over him. Next, we remember Estelle Kestenbaum, a longtime resident of Leonia, who we lost at the age of 91. And we have put up now hundreds of pictures. This one is my finalist for the best picture of anyone we've memorialized since we started this 6 months ago. Look at that shot. She was born and raised in Maryland, graduated from Duke University. Think about that for a minute. She passed at the age of 91. You can roll the clock back, and I'll bet you there weren't a whole lot of women on the campus at Duke University when Estelle was there. And also she called Baltimore and New York City home before settling in Leonia in 1969 with her late husband Alfred to raise their family. 3 decades ago, at the age of 60, she began working as the secretary to support Superior Court Judge Edwin Stern of the Appellate Division. For the next 20 years, she would make the drive from her home in Leonia to Judge Stern's chambers in Morristown, retiring at the age of 80 after 2 decades not only of service to our courts, but after serving as a mentor to many of Judge Stern's clerks. She was a lifetime volunteer with the League of Women Voters and also always believed in the importance of voting. Again, tomorrow, National Voter Registration Day. She would want me to say that. Sadly, before COVID-19, Estelle was diagnosed with Alzheimer's, which slowly robbed her of her life's memories. She leaves behind her children, daughters Janice, who is in Washington, D.C., and Nancy in New York City, and I had the honor of speaking with each of them on Friday, and Nancy's husband, David, and Estelle's son, Ken, who lives in Long Island, and daughter-in-law, Megan. along with her grandchildren, Rebecca, Ben, Connor, and Caitlin. She is also survived by her nephews, Robert, Ronald, and Bernard, and many, many friends. We are honored that Estelle chose to make her life in New Jersey, and may her memory be a blessing. And finally, today, we remember John Tone Jr. of Randolph. He was born in Orange and raised in West Orange, graduating from West Orange High School before proudly serving in the United States Marine Corps, achieving the rank of sergeant and earning accolades for his marksmanship. With his military days behind him, he returned to New Jersey with his wife, Thelma, to earn his degree from Fairleigh Dickinson University. He then began a career that took him from the entry-level job of clerk to his retirement as vice president of operations at Kyocera. Golfing with friends was a pleasure of his for many years, especially with buddies whose friendships spanned more than 50 years. Above all, however, John took enjoyment in his family, especially in his grandchildren, Andrew, Caitlin, and Joelle, and great-granddaughter Violet, to whom he was Poppy. He is also survived by Thelma after 52 years of marriage, as well as by his daughter Donna and son-in-law Don. I had the great honor of speaking with Donna on Friday. Thelma, Donna, and Don, at least, it may have been more, each of them had COVID, and it was not kind to them, so keep them in your prayers. He's also survived by his son John and his wife Faith. He's also survived by his sister Janice and brother Gary and their families, his nieces and nephews, along with many cousins and friends. May God bless and watch over John and all who knew him. So Don, Estelle, and John are among the more than 16,000 who have now passed away because of COVID-19, whether confirmed or probable. None of those who have passed deserves to be a number. And for them, we cannot give up on everything we've done over the past 6 months to save lives. This pandemic isn't over, and as we know, it is all too easy for the numbers to go back up. So even though I know that we're all a bit fatigued, more than a bit fatigued, we must remain vigilant, and we have to keep up with our social distancing and masking, especially as the weather cools and we're drawn back indoors where we know this virus is even more dangerous. Before we hand the ball over to Judy, let's change gears once more to acknowledge another of the organizations partnering with the New Jersey Economic Development Authority to ensure that we emerge from this pandemic stronger than ever. Today we recognize the Youth Development Clinic of Newark, which has for the past 60 years served the children and families in Newark and in the surrounding areas who struggle with mental health issues, poverty, and other challenges. At the core of their mission is their community mental health clinic that provides essential care and services to roughly 200 clients every week, and which complements its school-based counseling and support services. With the onset of remote learning, YDC had to quickly make the move to telehealth services. Executive Director Mark Kitsey, Dr. Mark Kitsey, with whom I spoke on Friday, and there he is on the right, worked through the EDA to receive a loan that has allowed his team to expand community outreach, including purchasing new technology for telehealth services and to keep key staff on the payroll. Because of this partnership, YDC continues to meet the needs of the children and families it serves. I thank Dr. Kitsey and everyone at the Youth Development Clinic for their commitment and dedication. Check them out at ydcnj.org. That's ydcnj.org, or call them at 973-623-5080, 973-623-5080. And finally, for today, a program note that this Thursday morning, I will be hosting a Facebook Live chat about our fight against the coronavirus with Dr. Anthony Fauci. That live stream will be available on my Facebook page, so go to facebook.com/Governor Phil Murphy and join us at 11:15 a.m. this Thursday, September 24. Again, that's facebook.com/Governor Phil Murphy. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. The COVID-19 public health emergency has taken a toll on the mental health and the emotional well-being of our residents. All of us have experienced a significant disruption in our day-to-day lives. We've been separated from loved ones, friends, and colleagues. Some of us have lost those closest to us from the illness. Many of those who have recovered from the illness still struggle with long-term health effects, and many families have been financially devastated. Grief, uncertainty, isolation, and lack of socialization with colleagues and friends has impacted all of us. Restrictions on our lives, such as limits on social gatherings, like weddings and funerals, have changed how we mark important milestones. And we know that these restrictions must continue for a while. We have been working together for more than 6 months to prevent the spread of COVID-19 in our state. We know that this new normal will persist for the foreseeable future, and all these factors are causing what is called pandemic fatigue. Pandemic fatigue is a feeling of exhaustion from the effects of COVID-19 health emergency on our lives. The key sign of pandemic fatigue is weariness. People may also feel helpless, sad, and irritable. Those experiencing this fatigue may have trouble focusing, or may have trouble with eating, or they may be sleeping less, or more than usual, or lack motivation and become withdrawn. While we may be feeling burned out, it's important that we take steps to care for our physical and mental health. Work on getting more sleep and eating nutritious foods. Unplug from social media and the news. Go for walks, read a book. Try another activity that can help calm your mind. Connect with others by a phone call or a video chat, or social support is vital to mitigating stress. As tired as we all are from battling of the pandemic, we have to continue to take precautions, such as wearing face coverings and social distancing, because this virus is still circulating, and we need to stay the course in this fight. It's like running a marathon. It's a long race, and we are all going to get to the finish line, but it's going to take time and perseverance. We know that when individuals are dealing with mental health stressors, some may turn to alcohol and drugs to cope. This May, New Jersey saw the highest number of suspected drug-related deaths seen in any month, not just for 2020, but for 2019 and for 2018 as well. Overall, the state has seen a 12% increase in suspected drug-related deaths from January to July 2020 when compared to the same period last year. Initiatives to get Narcan, naloxone, into the hands of more residents are vital for battling this epidemic right now. I encourage New Jerseyans to visit a participating pharmacy and to get this overdose reversal drug for free so that we are all ready to help save lives. Earlier this month, as the governor shared, the Department of Health, Department of Human Services partnered to deliver more than 11,000 free doses of naloxone to 179 emergency medical services teams throughout New Jersey. EMS clinicians have been responding to an increase in overdoses in the state, and we wanted to ensure that they have the tools they need to care for their patients. The department is also expanding our 5 Minutes to Help training. This is an initiative for EMS to improve connections to care for non-fatal overdose victims. The program has helped to train more than 100 responders on how to interact with patients after they have been treated for a suspected opioid overdose. This training includes how to link patients to resources they need so they can reduce the number of repeat overdose patients. For individuals who are struggling with substance use, they can call the 1-844-REACH New Jersey helpline to speak with live, trained addiction treatment counselors and to get connected to treatment regardless of insurance status. For those who are dealing with stress, anxiety, depression, they can call the New Jersey Mental Health Cares helpline at 866-202-HELP, H-E-L-P. Now, moving on to my daily report, as the governor shared, our hospitals reported 349 hospitalizations, and there are 87 individuals in critical care, with 37% on ventilators. Fortunately, there are no new reports of multisystem inflammatory syndrome in children. The children affected, as you know, have either tested positive for active COVID-19 or have had antibody tests that were positive for COVID-19. The governor reviewed the new cases and deaths reported. In terms of deaths, the breakdown by race and ethnicity is as follows: white 54.1%, black 18.3%, Hispanic 20.3%, Asian 5.5%, and other 1.9%. At the state's veterans' homes and the psychiatric homes, our numbers remain the same. The daily percent positivity statewide is 1.81%, the northern part of the state 1.30%, the central part of the state 2.15%, and the southern part of the state 2.51%. That concludes my daily update. Stay safe, and remember, for each other, for us all, please take the call. Thank you.
Judy, thank you. And your words regarding mental health, opioid addiction, alcohol use, etc., are extremely well taken and timely, sadly. And thank you for raising it, in addition to everything else you and your team do. Pat, I was very happy to see on the compliance report no reference to the wedding in the family on Friday, so that was a relief. Again, congratulations to Ryan and Megan, and to you and Linda and her parents, and great to have you back. Please.
Thank you, Governor. Good afternoon. With regards to compliance, we did have Central Park Restaurant in Roselle, a report of overcrowding. Police did respond and issue not only the owner but the manager for the EO violation, and also Island Dragway, which is up in Independence Township in Warren County. The owner there was cited. Police responded to traffic, and there was over 1,000 patrons there, so that owner was also cited for an EO violation. And beyond that, Governor, it's been quiet.
The weather, Pat, this week looks to be glorious throughout the entire week. So on the weather front, we knocking on wood here.
Perfect, and the first day of fall is tomorrow morning. It starts at 9:30, so it's going to be cool. Okay, well said. Before we start, Dante, we'll start over here with Matt. And Matt Plotkin has joined us. Matt, good to have you. We'll be on a schedule today, which has been our typical schedule, this week rather, which has been our typical schedule, as Dan tells me otherwise. We'll be here Monday, Wednesday, Friday at 1 o'clock each day, unless you hear otherwise. Virtual tomorrow and Thursday, and we have a White House call right after this. So we'll post you if we hear anything on that, either real time or at latest on Wednesday. If we could keep things moving along fairly crisply as a result of that, or because of that, that would be great. Dante, let's start here. Matt, good afternoon.
Good afternoon, Governor. Are the increase in the average daily cases and steady increase in the rate of transmission to the highest levels in 7 weeks? Is this any early ripples of a potential second wave, especially considering the first day of fall is tomorrow and colder temperatures are on the way? And you mentioned in your opening remarks Ocean and Monmouth counties. Those two counties are currently responsible for about 30% of the new cases in the past 2 days. Curious if you can point to any specific activities that are linked to the uptake in those two counties.
Yeah, both good questions. Judy, you and Ed should address both. Is this indicative of a second wave? And separately, what's the nature of in general terms, what the nature of what we're seeing in Ocean and Monmouth? I do know house parties, or at least a house party, is still on the list, unfortunately. That's a Monmouth a data point. I would think, Ed, Judy, that a second wave would, among other things, evidence in a much higher positivity rate than we have. So I'm as the amateur here, I'm personally of the opinion this is part of the ebb and flow, and partly explainable by specific events, and partly explainable by a lot of testing capacity. But with that, Judy, do you want to chime in, or Ed?
Well, we remain vigilant every day throughout the whole state, looking at what we would call a second wave. We know internationally that many other countries are seeing what they consider a surge in cases. Israel, as an example, has gone down into another lockdown of the country as a result. But I don't think we're seeing anything specific. I'm going to look at Ed, and he has eyes on this every single day, every minute of every single day. I'm going to let him share his thoughts on it.
And Ed, specifically, would we, as one indicator, am I right or off base here, you'd see a higher positivity rate? Is that accurate?
We would expect to see a number of different things. Certainly positivity, assuming we're testing enough, would be one of the early things that we'd expect to see. We'd look at number of new cases, we'd look at visits to emergency departments and so forth. And I'm going to agree with what both people said. I do not yet see a second wave. I'm always paying attention for the feeling of that undertow that might be suggesting that a wave is coming. And certainly any increase in numbers catches our attention and rightly increases our response to that area, but right now I would not say it's a wave.
Judy, how about Monmouth and Ocean? Any general color there?
We know some social gatherings, particularly in Monmouth, were responsible for increases, and generally in Lakewood, we're just seeing a general increase in cases. I don't think we've been able to identify any specific cause right now, but again, we're remaining very vigilant because Lakewood has been a hot spot in the past, and we want to make sure it doesn't happen again.
And it's fair to say, I don't want to put words in your mouth, we're probably a little bit delayed on tracking down because of the religious.
We have redeployed additional contact tracers into Ocean County, particularly to track down the cases in Lakewood, but the religious holidays were somewhat delayed in getting calls to the individuals.
Thank you, Matt. Dustin, good afternoon.
Good afternoon. Senate President Sweeney said today that baby bonds won't be included in the next budget, and the Star Ledger reported that you agreed that tax increases on cigarettes, guns, boat sales, limousine rides, and opioid manufacturers are also out. Any reaction to that, and can you explain your apparent willingness to back off on a bunch of tax increases? What details do you know about the network connection issue that led to more delays at motor vehicles today and left the agency unable to finish transactions? And do you know what's being done to fix it and when? And is NJ Transit's proposed transit grid project in Kearney subject to the new environmental justice law you signed? If so, has this been communicated to NJ Transit? And what's next now that the project has gotten federal approval to move forward? Thanks.
Thank you. Again, don't go down my throat, but I'm not going to have any more to say on the budget. The committee hearings are tomorrow, and I believe the budget will be, assuming it gets out of committee in the respective chambers, I believe the full vote would be on Thursday. Again, the spirit of common ground, teamwork has been exceptional, and the one piece of this that we were very happy to unveil was the millionaire's tax that'll be a part of it. Beyond that, stay tuned. I'm told, just literally real time, Dustin, that all locations at MVC are back up except Edison. That's hot off the press. I can't give you I can't tell you what the reasons were, other than it was a system breakdown. And Matt Plotkin may want to correct me if I'm wrong on Kearney. This is something that our team is clearly looking at, not just in light of the environmental justice legislation, but it's a project that we've been reviewing and will continue to review. Anything you want to add there? You're good. Okay. Thank you. Nikita, how are you?
I'm well, Governor. Thank you. So I just have two for you today.
I should keep this in mind in future days, right?
Yeah. You talked earlier about the death of Justice Ginsburg, and I was wondering, this has become an issue on the national level, but in New Jersey, would you support barring judicial nominations in the last year of a gubernatorial term? And then separately, there's a controversial ad running in the 7th Congressional District put up by the National Republican Congressional Committee. And I was just wondering what your take on that ad was.
So I've not seen the ad. Can I come back to you on that? And I've not thought about that. It's a very good question in terms of barring judicial appointments in the last year. I have tended to be, so I don't want to speak out of both sides of my mouth, but I was pretty clear and on the record that I thought it was a miscarriage to not hear Judge Garland's candidacy in 2016, particularly eight months out. And I'd secondly say you can't have it one way one year and a different way when frankly the facts have not only really changed, but they're much more acute in this case. But it's a good question. I've not given it thought, and I will do that. And I'll come back to you, Dan, on the ad. I've not seen it. Perhaps you and I can watch it after this, and we'll give you a reaction to it. Thank you. Sir, please.
Question for Judy Persicelli. Commissioner, can you bring us up to date with the progress of the contact tracing app that's been deployed on college campuses this week? And then also questions for you, Governor. What's your reaction to the CDC posting over the weekend that the coronavirus spreads mainly through aerosols and their reversal on that finding today? Does this change anything for state guidelines generally and specifically for in-school education? And if anybody on stage would like, it would be great if you could reiterate how COVID-19 spreads so we can clarify for the people of the state. Thank you.
I appreciate your asking me that question, but I will defer. I will say this, by the way, the Motor Vehicles Administrator, Sue Fulton, has come in. Vendor software issue caused interruption of network connections. Online transactions were not affected. We, meaning MVC and OIT, worked with vendor to fix the problem. By the way, it is already fully back up and operational. So that's the hot off the press answer to that. I will say this. What concerns me, the experts will answer the question in terms of how it's transmitted and the specifics, but the notion of injecting politics into institutions that have historically, through administrations on both sides of the aisle, have been beyond reproach in terms of their independence is really discouraging. And we have tried, I will say, I'm not patting ourselves on the back, we have tried it every single step of the way, even when the news was really bad, even when folks did not want to hear it, even when we didn't like what we saw, we have been upfront and called balls and strikes as best we can. So I'll let the experts answer the specifics, but the sort of back and forth on the guidance and the evidence of emails that are showing enormous political pressure should be completely and utterly unacceptable to the American public and certainly to the 9 million of us here in New Jersey. Judy and Ed.
I'll talk about the digital app. I don't have a full report. It was reported to me this morning that they're working out some bugs, and we hope within the next 2 weeks to deploy it throughout New Jersey. But I'll give a full report at our next presser on how it's going, or I can get back to you. I'm going to let Ed talk about. First of all, we have great respect for CDC, and we have great respect. MMWR has been around for as long as I've been around. Great respect for that publication, but maybe, Ed, you could give some color on that.
When we talk about how the virus is spread, what we're really talking about is this. When people say droplets, they're saying that these are the larger particles that tend to come out when you cough, when you sneeze. They don't travel very far. They fall to the ground quickly. That's why we talk about 6 feet distance and so forth. When we talk about aerosols, we're saying that these are smaller, lighter particles that can float in the air, and because they can float in the air, they have the ability to conceivably go longer distances or stay in the air for longer periods of time and then infect more people. It's really often not one or the other. It's often somewhat a continuum, meaning when you speak, when you cough, when you do those sorts of things, you're not producing either just the smaller particles or just the bigger particles. You're producing a mixture of both, and how much the virus hangs on to each of those and how much each of those plays a role is still something that isn't completely understood. So basically what you're hearing the discussions go back and forth on is basically how much we think that those viruses can be in those smaller particles and can go longer periods further away. And this is something that we are still learning. Certainly, we pay attention to everything that the CDC says. We read and pay attention to things that other scientists are saying, that the World Health Organization and other people are saying, as well as evidence ourselves that we get. So, as far as specifically the CDC changing its guidance right here, again, we pay close attention to it, but it hasn't directly impacted what we're doing day to day.
I would just also, I mentioned earlier when Pat was speaking that we have a great week of weather ahead of us. I think the more all of us can be outside and the longer we can do that, the better. And I would say, secondly, we have to live our lives, right? So we want we have to get back into school. We want to get back into gyms and dining, both in and out. But I'm personally, again, I'm the amateur on this one by a long shot. I think you assume the worst and hope for the best. Just be smart. Assume that it's around us and behave as though it is, and again, balance that with living our lives. And God willing, that's a balance we can strike. Thank you. Dave, good afternoon.
Hi, Governor. I think Matt was referencing this earlier. The statistics from last week show that 22% increase in COVID cases according to the COVID-19.nj dashboard. You've talked, Governor, about the fact that it seems like large gatherings, especially with the younger people, is basically responsible for this. Is that still the case, and is there anything else going on? And if it is the case, is there anything we can do? Because so far it seems like nothing seems to register with these younger folks. Also, Judy, if you would be kind enough to expand on your pandemic fatigue comments beyond alcohol, increased alcohol and drug abuse. I mean, what are some of the signs and symptoms of fatigue, COVID fatigue? Would you include the mask droop syndrome as part of this? One personal note, I did notice this again, and I have been thinking of not done it yet, and I told Dr. Ed this. I've been considering announcing myself as a representative of the health department when telling people they're required to wear the mask over their nose. I have not done that yet. But I mean, what's going on here? Is this part of this COVID fatigue, the sloppiness, where people, it's like they're too tired to do it or something? And how do we try to respond to that? A last question, nursing homes have, many of them, the rapid COVID-19 test, but my understanding is the health department does not want them to use it and will not accept these tests. Could you explain what's going on with that and whether any of these tests are more accurate than others? And wouldn't that be helpful to try to spot this kind of stuff at the long-term facilities quicker? Thank you.
Dave, a point of personal privilege. Before I begin the answers, I want Pat to add a little bit of color. This gets to the pandemic fatigue, opioid challenges we have. Pat just came up with a fascinating statistic.
Yeah, just because of the ROC monitors, we have a drug monitoring initiative to make sure we track not only accidental overdoses, but also Narcan deployments. And just to put it in perspective, law enforcement and EMS personnel so far in 2020 have issued Narcan 10,155 times, which is that's about 40 a day. So to the governor's opening remarks and the points that it's a life-saving drug, I have it in my truck. Every trooper has it. Law enforcement throughout the state have it, and that's why the citizens should take advantage of that giveaway, because it is a disease that has killed over 50,000 people in America last year, and we need to save as many lives as we can, and hopefully get those folks to recovery coaches and into programs that ultimately save their lives in the long run. Thank you, Governor.
Pat, presumably, you don't have it at your fingertips perhaps, but presumably that number is up this year over last year, would you guess?
Yes, I believe it is, Governor. I can come back on that later in the week, too.
So thank you for that. I wouldn't say, Dave, it's only kids, but there is a disproportionate amount of what you're tracking of sources of this with younger folks. Judy, I don't want to put words in your mouth, but we had as we always do, have a warm-up call. No evidence as we sit here of in-school transmission. No evidence that it's related to playing sports, and yet you've got kids on sports teams who have it, we believe, at the moment for collateral reasons, and obviously that's something that tracking down. Gathering to worship is another potential source. Services of kinds, whether it's funerals, weddings inside. So it's not entirely kids. And what else can we do is a good question. We're going to continue to test the heck out of the state, continue to enforce. And by the way, the compliance is overwhelmingly in a good place as it relates to places that we can influence and enforce. So gyms, Restaurants overwhelmingly are doing the right thing, to pick two. Houses of worship overwhelmingly doing the right thing. Again, I think this is an ebb and flow reality. And again, we're in as good a shape as any state in America, but I think it is with us. And the question is, we have to collectively continue to mitigate what with us means. I appreciate your willingness to walk up to somebody and claim membership in Judy's team for the Department of Health on mask covering. I assume it is that. I mean, Judy, I assume people, as I said earlier, people are fatigued. And then lastly, you've got a very specific answer, I know, on the nursing home rapid antigen test, so please.
And just on the pandemic fatigue, I think that the overwhelming feeling of helplessness and wanting this to end is different than willful ignorance of wearing a mask when you think you're invincible. If you're young and you say, well, my friend had it, he or she just got a little sick. I can do that and no problem. I think that's a different issue. The issue we were talking about is true, the emotional well-being of people really being affected by such a change in our normal day-to-day lives. As far as the antigen testing, I'm going to let Ed talk about the analysis that we keep ahead of on the antigen testing and the utility of it, not only in nursing homes, but generally.
And by the way, Judy and Ed, this is not specific to New Jersey either. This is a debate that's national. Is that fair to say? Yeah.
So when we look to diagnose the virus, there are two tests basically that can be done. One is the old PCR test, which can be done in a lot of different ways, and it has the advantage that it is the most specific and sensitive. It can pick up tiny amounts of virus, and the reason it can do that is because it works like a copying machine where it keeps on replicating the virus until it gets to be enough that it can measure. The big disadvantage to it is that it's slower. It can only be done, well, almost only can be done at major laboratories. It is means the turnaround times are hours into days, and occasionally it's gotten as long as weeks, although we're seeing it much better now as far as that turnaround time goes. And it's also a much more expensive test to use. So people are continually looking for faster, quicker tests that could take its place or that could work together with it. And that's where antigen testing coming in. Antigen tests have been used for different things. If you've gone to the doctor and you've had a test for a strep test, for example, for strep throat, that is an antigen test. They have the advantage that they're quick. They can be done with little or no machinery. They can be done in places like doctors' offices or in nursing homes and long-term care facilities, certainly in many of them. And they are relatively cheap. The trade-off for that is because they don't work like that copying machine and they don't keep on replicating that virus, they can't be as sensitive, meaning they can miss and will miss people that will turn positive on a PCR test. And they also tend not to be as specific, meaning you are more likely to get a false positive on them than on that PCR test. So it's always that balance of, yes, we certainly think it plays a role because it is quick, it is cheap, it is something that you can do relatively frequently, you can do it right then and there, although only one at a time. But it is not as accurate. So exactly how do you use those two tests? How do you work them together? We're still working to that, but there are certainly places that we think it will be used and should be used, and other places we're less confident.
Ed, thank you. And for the time being, I think the guidance is you want them to do both, right? Not just to rely on antigen alone?
For now, the guidance is basically we want that the PCR test is the test of record, meaning that's the test that we're going to most believe.
Thank you, Ed. Thank you, Judy. Daniel, you'll take us home.
Hi, Governor. So jumping off a prior question of the second wave, it's been over 2 weeks since we've had indoor dining in gyms and theaters. What has the data shown? Are these increases in new cases and transmission and positivity coming from that? I mean, you had said that the owners are doing a pretty good job with sanitization and social distancing and face
coverings. I'd say very good job for the most part.
Okay. And I guess the second question, with the younger people getting it, are these parties and social gatherings the only source of these new surges? Is it also that they're back at universities? I know there's a piece from National Geographic last week that many of these younger people are doing retail and food service jobs where there's a higher risk to get it. So is there any other source of the surge that the data is showing? Thank you.
Thank you. I'll give you my thoughts, but would love you two to come in, Judy and Ed. I don't think we have evidence at this point that that leads outbreaks back to any restaurant or gym or indoor entertainment or movie theater behavior, right? We do have house parties, other gatherings, but again, I don't want to overstep. We don't have in-school transmission data, and there will be, by the way, right? So this is, given the amount of kids we have in school, people who go out to dinner, people who go to gyms, but we do not have that at the moment. And there could be, I would just say there could be some connection back to folks who are younger folks. I didn't see the article, but your point is you've got maybe a disproportionate representation of essential workers, food, retail, whatever it might be. Perhaps, but again, I don't know that we've got data that supports that. Colleges, certainly, we've seen some hotspots in off-campus housing. We've seen it through athletic programs. Again, no evidence that it's specific to playing athletics, but in ancillary or tangential activities. But we'll let the experts weigh in here.
Yeah, I just want to, talk a little bit about case investigation and contact tracing. You've heard us bring it up over and over and over again. Well, there's a reason for that. Without really good contact tracing, we won't be able to answer the questions to a higher degree of certainty that you just asked. We want to be able to contact trace, identify, who were you in contact with? How are those individuals doing? Is there a particular outbreak amongst a cohort of individuals that have been in each other's company for a longer period of time? So again, answer the call. If you test positive, please share the information so that we can answer these questions and share with the public to a greater degree of certainty what type of transmission we're seeing.
It's a great point. It's a great tee up, Daniel, to make that commercial. Answer the call. And again, we don't condone and never will illegal behavior, certainly don't condone underage drinking. But to use the house party example, it's not what the call is about. The call is about public health. It's getting better, but it's still not where it needs to be. And so with that, thank you. I'm going to mask up and have a couple of thoughts here as we depart. First of all, Judy and Ed, thank you, as always. Pat, likewise. Jared, Matt Placken, Dan Bryan. Again, tomorrow virtual, Wednesday, 1 o'clock in person. Again, White House call this afternoon. Those have become less frequent. Looks like it's sort of an every other week mode at the moment. But we'll all be on it. And if we get anything, and some of you have asked some questions, whether it's CDC or antigen testing, that we may well get some more color. Again, I just ask folks to not only keep doing what you've been doing, both individuals as well as folks who run establishments. I did a quick spot check into a gym, a health club on Saturday, and it was impeccable based on my anecdotal quick inspection. I'm going to hit a school this week, trying to sort of go around. We continue to dine. I've stayed outside so far because the weather's been with us. But based on the evidence we've got, folks are overwhelmingly doing the right thing. And the only, Judy, the exception is probably the last point you raised. We need more of you to pick up the phone and answer the call. And just be straight. This is what I know. This is who we're in touch with. The folks who do this are from your community. They've got no agenda other than the public health agenda. They're trained. They know that confidentiality is important. And so please, please, please take their call. Many thanks. God bless.
positive patients or persons under investigation. There are 102 individuals in critical care, with 34% of them. The breakdown of race and ethnicity of these cases is white 17%, black 35%, Hispanic 39%, Asian 6%, other 4%. The governor reviewed the new cases and deaths reported. In terms of deaths, the breakdown of deaths by race and ethnicity is as follows: white 54.1%, black 18.2%, Hispanic 20.3%, Asian 5.5%, and other 1.9%. At the state veterans' homes, the numbers remain the same. And at our psychiatric hospitals, one new case has been identified. A patient at Greystone Hospital has tested positive. That leaves a total of 215 cases total in Greystone Hospital. The daily percent positivity as of October 1st is in New Jersey 2.62%, the northern part of the state 2.18%, central 3.30%, and the southern part of the state 2.56%. That concludes my daily update. Stay safe and remember, for each other, for us all, please take the call and download the COVID Alert NJ app. Thank you.
Judy, thank you for everything, including, again, I repeat for the umpteenth time, for reminding us of the stark disparities and inequalities across racial lines that this virus has laid bare. So thank you for all. With that, Pat, over to you. Hope you're well. Thank you for your leadership, compliance. How are we doing out on the West Coast, and any other matters?
Thank you, Governor. Good afternoon. Over the weekend, there were 2 executive order compliance summonses issued, one at Cuban Pete's in Montclair for being well in excess of the capacity limit, as well as in Gutenberg, where officers responded to restaurant Cosmos 2000, where again, capacity was far exceeded. With regard to our DEP Forest Fire Service, they are still out there in California. We are working with the California Office of Emergency Management to see if they are going to extend that deployment. So whether that means that team stays or we swap out a new one, we'll probably have that ironed out within the next day or so, Governor.
And Pat, this is the second team, right? This is still the second, so.
That's correct.
Right. Thank you for that and for all. We'll start over here with Elise. Before we do a couple of things, we're going to at least experiment this week by shifting our schedule a little bit. We're going to go to a Monday, Thursday, 2-week schedule, subject to, obviously, the events that are around us, which feel like they're getting more intense as opposed to less. And assume, unless you hear otherwise, that we'll be back in here on Thursday at 1 o'clock. And we'll be virtually with you the next couple of days. Again, we're going to try it this week. We reserve the right, I hope you'll bear with us, to shift to a different schedule if events warrant that. And I don't know how many on the road daily events we'll do going forward, but I thought our trip, I'd defer to my colleagues here, I thought our trip Friday to Ocean County was very productive. We had leadership, health from the county, law enforcement, health, elected officials, faith leaders, educational leaders. And I thought it was a good visit, by the way, great, again, can't say this enough, hats off to everybody. Everybody checked their partisan affiliations and beliefs at the door. Nothing but the facts, nothing but focusing on what we need to do together to get our arms around it. And that's something we may want to try again at some point. Ocean County remains a high priority, as Judy went through the math, and Lakewood, but not just Lakewood, as we mentioned, at least Jackson, among other townships. I know you highlighted on Friday, we're also having elevated case numbers, so we will continue to keep an eye on that as we do around the state. I also want to belatedly welcome Jared Maples, the Director of the Office of Homeland Security and Preparedness. With that, Elise, good afternoon. By the way, if you all could be economical, that would be a huge treat for us, because there are a lot of folks here today. Thank you.
Good afternoon. 2 questions. Governor Cuomo is shutting schools in New York City hotspots. Have you set parameters for doing the same in Lakewood? And with regards to the Bedminster contact tracing, this morning you said you need more from the federal side. What did you mean by that? Thank you.
Thank you, Elise. And Judy, you should come in behind me on either of these, but we reserve the right to take similar steps as Governor Cuomo and Mayor de Blasio are taking. I think the word I've been using over the past number of days is a scalpel as opposed to a blunt instrument, as we've seen these, and Judy, you should disagree, or Tina, if you see it otherwise. We're seeing, we report, for instance, today, an aggregate spot positivity for the state of 2.62%, but as Judy reported in her report, you've got numbers that are in the teens in some places. So, and if you look at the reports by county, a blunt statewide instrument looks less required at the moment as opposed to scalpel, whatever it is, a school district, a set of non-essential businesses, et cetera. So those options remain on the table. I would just say, in addition to being, calling the trip in the face of facts reckless, I said bordering on reckless. I've just graduated the trip to reckless on Thursday. We just haven't had the level, as robust a partnership as we want. The lead has clearly been New Jersey on this, even for folks who are not from New Jersey, I might add. And I don't mean the staff members. The 19 folks that I referred to are clearly all Jersey folks, and that's Somerset County and Bedminster are taking the lead with Judy's team and Tina. But the list of attendees of the 206 was a national list with a good chunk and dose of New Jersey folks, but folks elsewhere. And it's at a moment like that you need as robust a federal response as we have had at the state level. So there's been a response. We got the list. I think we got it at 2:30 on Friday. That sounded right? About right? About 2:30 in the afternoon. We need more. We need more. We needed that trip not to happen, number one. And number two, we need more. I can't say enough good things about Judy's leadership as well as the Somerset County and Bedminster leadership. Let's go around the horn over there. Nikita.
Hi, Governor.
Hey.
So I want to ask first, so with the election about a month away now, there's still not any info on how Perth Amboy is handling their runoff. When do you expect to tell them? And then at this point, have you read, skimmed, been briefed on, or otherwise been informed on the contents of the report that the State Commission on Investigation released last week that said that your administration was aware of nepotistic hiring practices at the SDA?
Yeah.
And are you aware of a post office issue in West Orange and North Arlington where some batches of mail were dumped in the dumpster? Have you discussed it with USPS? And for the commissioner, is there any concerns about mail that has literally been in the trash being forwarded to recipients?
Okay. That's certainly a diverse set of questions. I've got no news on Perth Amboy. Matt Plakken's with us. Any news there? So nothing to update you on that. On the SDA report, I have been briefed on the report. And though I do not agree with all of their conclusions, I look forward to working with all the parties to continue to improve the SDA. And at the risk of beating the same drum as I've beaten with Dustin a couple of times, I think Manny De Silva has done a terrific job over the past year, and he and the board and their employees have made great progress. I'm not aware of the West Orange or North Arlington reality, but Matt Plakken's going to come in and tell us his viewpoint.
Yeah, we were notified by USPS over the weekend. It's a matter that's under investigation, but as you noted, Nikita, the mail was recovered from the trash receptacle and has been put back in the mail stream.
Judy, I'm not sure how to answer the last question. I've never been asked this question before. To the best of my knowledge, I've received a lot of trash mail, but I'm not sure I've received mail that's been in the trash.
Well, if you do receive mail that's been in the trash, open it, but wash your hands before and after, and dispose of the outer envelope appropriately.
I don't think I'm breaking any new ground, but the Murphy household, whoever opens the mail, no matter where the mail's been, automatically, when they finish, washes their hands with soap and water. And I would say we double underscore that advice. Let's come down to Brent, and then we'll go to Dustin if we could, right here. Thank you.
Hi. Should you, you both had confusing things there. Should you or shouldn't you have a communal bowl for Halloween? Will Trump National Bedminster...
Sorry, one more time?
Should you or should you not have a communal bowl for Halloween?
You should not have a communal bowl.
Should not? Okay.
Should not.
Will Trump Bedminster be closed for cleaning? Because statistics show people of color are more likely to hold jobs as waiters and chefs there. What worries do you have for communities that may have been already disproportionately hurt by the coronavirus, by that event?
Oh, but communities that were over-anxious?
Communities of color overwhelmingly hold more jobs as chefs and waiters. How are you concerned about that after the Trump event? How has the DMAVA and DOH cooperated with the AG's investigation into veterans' homes in Paramus and Menlo Park? And what has the administration learned about what went wrong at the veterans' homes to result in such a significant amount of death there? And the DOL said the $300 unemployment benefits would be paid in October. Are there any updates on that? And I have one from Nancy Solomon of WNYC. Rick Maida said there was no need for him to quarantine after attending Trump's event and said, "You are fear-mongering." Do you plan to take any action against attendees who don't quarantine?
Okay. No communal bowls for Halloween, unless my colleagues to the right disagree. Yeah, I am concerned. I don't know the personal demographic profiles of the 19 staff members, but I am concerned, as we all should be. So this never should have happened. Now that it has happened, everybody's got to self-quarantine. And again, the testing window, you got to let this incubate. I think the testing window, unless Judy or Tina disagree with me, would begin tomorrow. We take every loss of life deadly seriously, and certainly of our blessed veterans. That investigation review process remains underway. But as I say, every day, the first three numbers I look at are 62, 81, 3. Those are the losses of lives, respectively, confirmed, by the way, in Menlo Park, Paramus, and Vineland. I've got nothing to update unless Matt Placken does on the $300 supplemental. We'll come back to Brent if Rob Angelo has an update on that. I don't even know who Rick Maida is, but I saw that he said that. I think literally, and I don't think this is the first statement that he's made that I would say this, but certainly this one qualifies. I think that statement should disqualify him from seeking public office. Dustin.
Good afternoon.
Good afternoon.
It appears that the White House doesn't plan on tracing donors at Bedminster because they supposedly didn't spend more than 15 minutes within 6 feet of the president. Has the RNC or White House provided you with more than names and emails? Do you plan on more thoroughly tracing these individuals from New Jersey besides sending out an email? How many guests were from New Jersey? How many Bedminster staffers have we traced? And did they cooperate? What specific guidelines were allegedly violated at Bedminster? And to go back to beating that drum on the SDA, are there any specific conclusions of that report that you disagree with? And don't the new revelations about your office's communications with the agency lay blame for that scandal at your feet, contrary to what attorneys you hired said, which was that Lizette Delgado Polanco, quote, must shoulder a majority of the blame for what ultimately occurred? Thanks.
Judy, you should come in on the, so you got emails, and successfully, I think, we're able to connect on email with 184 of the 206, is that right? How many were in New Jersey? Do you have an exact number? About half, we think? About half, we think? But bear with us, because that's not we believe it's about half. Staffers were all New Jersey. All 19 are New Jersey. Judy's been in touch with the CDC. We have been in touch since Friday morning with the White House. All of this remains a work in progress. And guidelines that were violated, as described to us, potential guidelines were too many people indoors. I don't think there was an outdoor guideline violated, to the best of our knowledge, but that's to the best of my knowledge. But there may well have been exceeding capacity inside. There's been some discussion that there was buffet-like food setups. The buffets are prohibited in our state. You could have food service, but you have to be at your place and it has to be brought to you. And again, I'm not saying that as a definitive matter as much as that's sort of on the list of what we have heard. And again, I don't have any more specific to say on SDA other than I've been briefed. I don't agree with all the conclusions, and I think Manny's done a terrific job and his team. Anything you want to add on either you or Tina on the contact tracing front? You good with that? Okay, thank you. Sir, do you have any?
Yeah, two quick ones.
Yep.
Governor Murphy, do you consider the fundraising events in Bedminster to be a violation of your executive order on indoor gatherings? And can you clarify if initial outreach has been completed for all attendees and staff from the events in Bedminster, or if initial outreach has only been completed so far for New Jersey residents at the event?
So I think I've just answered the first one, to be determined, but based on this, the description of the indoor aspect of the event, potentially in terms of violations, and I think on that list would be potentially, and again, I'm saying potentially, this is a matter for the Attorney General, more persons in the room than should have been in terms of capacity, food related. Let me just say this, the other thing is we're crystal clear on one thing which has to be said. If you've been exposed to someone who is COVID positive and it's a meaningful exposure, you have to quarantine. You have to take yourself off the field. So the fact that there's being touted that the people at the indoor event were given a test and they all passed it or they wouldn't have been in there misses the point. They were, as far as we know, they weren't the issue. The issue was the people that they were going into the room with who had flown in. The initial outreach has gone well beyond New Jersey, and I mentioned a minute ago, and I don't want to misstate the number, 184 of the 206 have been contacted, and all 19 either have been or will be contacted of the staff, and of the 184, it includes a significant amount of non-New Jersey names. Clearly, New Jersey's our top focus, but we have done our part to reach out to people, and again, it was national in scale. I know, Judy, I've heard Texas, Arizona, where else did you have?
Indiana.
New York?
New York, Connecticut, Indiana, Minnesota was on their own.
Yeah. So that's not just in New Jersey. Thank you for that.
Good afternoon, Governor. My name is Don Collins from WCBS TV.
Hey, Don.
Two quick ones for you.
Always welcome, by the way.
All right, thank you. First one, with the number of cases that are coming out, with the uptick in cases, do you see a second wave coming? And if so, is the state prepared with PPEs, ventilators in hospitals? Are there enough rooms in hospitals?
Is that it?
Yeah.
I'm not sure, Judy or Tina, whether you call this as more of the first wave or a second wave. I frankly, I'm a non-medical expert, as if I have to tell you that. Don't spend a lot of time distinguishing between what wave it is as much as dealing with the facts that are before us. I'll defer to Judy and Tina. And are we prepared? I think we are, but I tell you, the last thing we're going to do is spike any football. So whether it's bed capacity, PPE, ventilators, we are building toward a 98 million piece strategic stockpile of ventilators. We're building toward 2,600 ventilators, and we have in use at the moment 34. So I think we're prepared on that front. We've kept the bed capacity both in the hospitals as well as the field medical stations, even though they're no longer up. Testing, we are among the highest per capita testing capacity states in the country, and we aim to keep it that way. Any color you'd add, either of you, and by the way, Tina, does it matter to an epidemiologist whether it's the first or the second wave, or you just call it the facts as you see them?
Well, what we are concerned about is looking at the trends over time and who is actually impacted with COVID illness. So, for example, as the commissioner had mentioned, there's been a changing demographic of who's getting ill right now. So, at the beginning of the outbreak back in March, we were concerned about older individuals. That's who was being hit in the long-term care facilities, individuals who are more vulnerable. Right now, we're starting to see a lot more cases among younger individuals. And it's not just here in New Jersey. It's throughout the country and in our region. And for that reason, that's actually going to be more important to take a look at why are these groups getting impacted and how do we reach out to them to ensure that they do the right thing? Social distancing, the masking, the whole 9 yards.
I reached out, and Judy knows this, I reached out, as I do regularly, just happened to do a bunch of them toward the end of last week with 5 hospital CEOs, and they're all seeing a modest increase in hospitalizations, differing, as Tina has said, different demographic to some extent. They feel a lot more confident about their ability to treat it than they did 6 months ago. I think we've said that a fair amount here. And those are sort of the headlines that I took away, and that was a smattering across the state. So that's, Cooper all the way up to Holy Name and a couple of others in between. Thank you. You good, sir? Alex?
Good afternoon, Governor.
Good afternoon.
A quick clarification for the Health Commissioner. When you said 215 positive tests at Greystone, did you mean statewide? These are the psych hospitals, these are the human services positive cases, and is this since the pandemic began?
It was for all psychiatric hospitals, the 4 psychiatric hospitals.
Got it. And so sort of my broader questions for you guys. For Colonel Callahan, if there was some sort of EO violation issued to the President's Golf Club, what would it entail? Would there be a fine? Would there be a closure? Who would actually serve that? Would it be a trooper's name on that citation, perhaps even your name yourself? For the Governor, I know you said that the way you found out about the President's positive diagnosis for COVID was not an official from the White House. How did you find out? Did you receive a call from the Health Commissioner, or was it on the news or the media or something like that? And for Dr. Tan, I wonder if you could clarify for us, there's been a lot of confusion over when someone tests negative for COVID-19, it's sometimes seen as basically a clean bill of health. Can you explain a little bit more about how the tests and the virus work and how somebody can test negative but still be having the virus incubating inside them? Thank you.
I think Pat and I are just, your question of how does it actually happen, that's a matter for the Attorney General and the Somerset County Prosecutor in this case. So we'll leave it to them unless there's anything you want to add to that. I wake up early in the morning and I found out about a combination of press as well as emails from folks who had seen it through the night, including we've lived around the world, so we've got some friends in Asia who probably saw it before the rest of us. I did not hear it on an official channel. We immediately, by the way, reached out to both family members and the White House staff to express our, on the one hand, our prayers and best wishes, and on the other hand, on more of the business side, that we need to be able to find quickly a way to work together on contact tracing. I was talking to Pat about the citation. Tina, I missed the question to you, but please take it away.
So related to why, the timing of the test, when people get tests, sometimes if you get tested very quickly after a possible exposure, you might not actually be able to pick up the fact that you have an infection. So for example, with what we typically talk about for diagnostic testing, the molecular PCR testing, if you get tested the day after you were exposed to someone who is a COVID-19 case, you might not have had, have built up enough virus to be able to be detected by the test. So the reason why we are concerned about when people test and the type of test is that it depends on the characteristics of the test itself. It also depends on, the timing of when you might have been exposed and when you can actually get detected. So, that's why we recommend that in the event that you have had a close contact exposure, if you're concerned about getting tested, to wait roughly about 5 to 7 days after that exposure to get the diagnostic test.
It's common sense, I guess, right? I mean, that's sort of the way a virus would incubate, even if it weren't COVID, right? That's just
the other thing, too, is that we recognize that the incubation period is roughly 1 to 14 days. But what we've been finding from a lot of the reports of the COVID cases throughout the country as well as worldwide, the median time when you start seeing people turn positive is roughly around the 5 to 7 day window, which is why we're making that recommendation.
Okay, thank you, Tina. Thank you, Alex. Catherine, is that you back there?
Yeah, how are you doing?
Well, I can barely see you, but I know it's you.
Thanks. So I know you don't want to talk specifically about the investigation at Bedminster, but is there any way you could just talk a little bit about, what an investigation into social distancing typically looks like how long it could take, and what kinds of penalties could we see? And then to the governor, you mentioned using a scalpel approach to new restrictions as opposed to a broad mandate potentially. What might those restrictions look like, and have you spoken with local community leaders to that end? And then, Governor, could you just clarify, have you received any more phone numbers or addresses for the attendees at Bedminster? Thank you.
Yep. Catherine, just give me one more second on your first one. So, you said we can't talk about the investigation, but I just wanted to make sure.
I was just curious if you could just talk generally about what a typical investigation into social distancing could look like. Like how long does it take?
I see.
What kinds of penalties are issued? Just to give us a sense of what.
You don't mean health, you mean enforcement.
Enforcement.
Yeah.
Correct. Yeah.
I mean, I assume, and Matt should weigh in here as a general matter, you're going to look at whether or not any of our executive orders were violated. So I mentioned 2 potential. And again, it's just to be determined. I'm not the Attorney General, and that's something, as Pat reminds me, him with the Somerset County prosecutor would be taking the lead. But 2 potential would be, how many people did you have in a room relative to the capacity of that room? And we're pretty clear that our indoor limits are the lesser of 25% or 150. That's one. The other one that I use as an example would be, we're okay with indoor food service, but we're not okay with buffets or you getting up to get your food. You have to be seated, and the food has to come to you. And that's, I think, for fairly obvious reasons. You don't want people, milling around and crossing paths, et cetera. So those are 2 areas, by example, as a general matter. Anything we would do with a scalpel would be done, and we're constantly in touch with local leadership. As I mentioned on Friday in Ocean County, we had leadership not only at the county level, but at the community level in Lakewood, at both elected, faith, education at the community level. So whatever we would do, it would be done with the community or the county, and things would be looking at some of the things that we've opened, particularly inside, steps that we've taken, and assessing jointly with the community leadership whether or not we should reconsider some of those steps. And do we have more information, phone numbers, addresses, et cetera? And I think it's sort of a mixed bag at the moment. Is that fair to say? So with staffing, I think we have what we need. I don't want to put words in your mouth. And it's a mixed bag as it relates to the attendees, including folks, as I mentioned a few minutes ago, there's a big chunk from New Jersey, but there's a big chunk from outside New Jersey. Dave, good afternoon.
Hi, Governor.
How are you?
After President Trump tested positive for COVID, there was a lot of shock, and people seemed to be really jarred. And do you think it's refocused the whole COVID issue for us here in New Jersey? I personally noticed going shopping in a supermarket over the weekend, I did not see one person wearing the mask under the nose, which was actually shocking.
Wow.
And people just, it felt a little different.
Yeah.
What's your feeling about this? Is this perhaps the silver lining in this whole situation, that it would refocus us and remind us, even the President of the United States rushed to the hospital could have a problem here? I know you mentioned that the Attorney General's office is looking into the possible violations of the executive orders in New Jersey. Have you spoken to the AG about this? And, would you be confident that he's going to take appropriate action? And do we have any idea how long this could take? And then, final question on the bear hunt. Could you talk a little bit about your philosophy about the necessity or not necessity for a bear hunt? And I know you said the Fish and Game Council is going to take up a proposed amendment to change the state's game code. Why are you so sure about that? Have you directed them to do this? How does that work? Thank you.
All good questions. I think on your first question, I think it has. And I please God everyone gets better here. We've reached out, as I said, to both family, to staff. I exchanged notes with Governor Christie on Saturday, my wife with his wife. And we've reached out to folks in his orbit. Please, God, everybody gets through this. alive and well and healthy, there's no silver lining to a loss of life. There just isn't. So no matter how much it may have raised awareness, please God, let's get everyone, the president, the first lady, everyone who's been infected. But yeah, having said that, assuming everyone does, and I'm not going to would that they do, I hope people finally, this guy Maida, that's somebody who's in outer space. I think and pray that that's an exception. I think anybody who's reasonable, anybody who accepts just any amount of, we have to base any decisions on science and data and facts. It's the evidence is so overwhelming what works. On the one hand, it's basic stuff, and then on the other hand, what puts you at risk. And indoors, close proximity, no face covering, with folks, if that weren't enough, with folks who are COVID positive, that to me is a bad cocktail, Judy and Tina, right? Secondly, the AG, I haven't been in touch, but that should not be any significance or news, because I respect, and we have since the moment one, the independence of that office, and it needs to be that way. I assume he's looking at the same facts that we're looking at, and again, some of this is to be determined. I'm not jumping to conclusions even myself. My philosophy has been on the bear hunt, and Matt Placken will give you a little bit more color in terms of the specifics on the council. My philosophy from day one is there has to be non-lethal ways to manage the issue. Other states have done it. States that look like us have done it. Connecticut hasn't had a bear hunt, I believe this is right since the 1840s. So there's got to be a way to get at this to both protect public safety and to be humane. And we believe after this year that we'll be able to achieve that balance. Matt, anything you want to add to that?
The bear management plan that's currently in effect that sets the hunts runs through this year. So they have to issue a new rule, and the commissioner with the council has already worked, as the governor announced, to put forth the proposal which came out today.
Thank you. You must be Gary, right? Gary, nice to see you.
Hey there, thanks so much. So just to confirm these numbers, because there's a lot of numbers thrown around, 184 people, you were emailed 184 people, or they responded to your email? Which one is?
184 emailed.
Emailed. So what are you guys doing about the 22 people that you did not email? That's one question. Next is, you say every hour matters here. It's now been 4 days since the fundraiser, 3 days since you first got their emails. What level of cooperation and response have you gotten from those 184 people?
Is that it? Judy, you jump in here. So one question beyond the 184 is either more information